afternoon, Facebook friends. My name is Melinda Metz, and I'm the Community Relations Coordinator for SourcePoint, the aging services provider for Delaware County. And with us this afternoon, we have Shelia Hiddleson, the Delaware County Health Commissioner. Welcome, Shelia.
Well, thank you for having me.
We're so honored to have you with us today. We have some very meaty questions, and one that came from one of our health and wellness participants this week. So we're excited to get that to you. So what exactly does the Delaware General Health District do for Delaware County?
Well, we are the only health district in Delaware County. We're a combined health district, so we serve all of the cities, the villages, and the entire county. And we normally fulfill all of your public health needs. We have several environmental health programs. If you go to a restaurant, have a tattoo, go swimming in Delaware County, we license and inspect all of those facilities to make sure that when you go, you and your family are safe. What a lot of people think of the health district for are flu vaccines, which we do give those, and we're really encouraging our community to get those this year. We also do regular immunization, so all of the childhood immunizations starting from 2 months and up. And then we do some tuberculosis testing. We work with a lot of our community partners on that. We also can do HIV testing. And those are our environmental health and our personal health divisions. We do WIC, so all of the women, infants, and children for the county. That's a birth through 5 nutrition program. And then we also have our community health department, and that division really is doing all of the things related to our community health assessment, our community health improvement plan. We have a big tobacco grant right now, so we're really trying to work with our community to get policies into place to have a safer, well, not safer tobacco use, but less tobacco use because we have better policies related to that. We do, in that division, we have a car seat program so we can check. Our car seat technicians tell our community members that out of every 5 car seats that are installed, typically 4 of them are installed incorrectly. And it's because we have so many different car seats and so many different cars. And we have staff that are trained. They have to do a renewal training every year to learn all the newest and greatest. And they know how to install those car seats. And we have the families come, they bring their car seat in their car. We show them how it all should be done. And then we take it out and we say, here, now you go ahead and do it again. We also have a litter and a recycling program and a solid waste program. Gosh, and of course right now, well, we always do communicable disease. So 24/7, 365 days a year from whenever health districts were first thought of, which was a long time ago, we've always done communicable disease. And so in Ohio, we have what are called Class A, B, and C reportable diseases. And depending upon what kind of a reportable disease, it either has to be reported immediately, by the end of the day, or by the end of the week. Of course, everyone knows right now that we're responding to the COVID-19 or the coronavirus. And so that is a communicable disease. So what we're doing with that is what we've always done with all communicable diseases. We're just doing it on a much larger scale than we normally do.
And just so people can sort of picture in their minds at home what the flow is of who has responsibilities for surrounding the pandemic and response to the pandemic. It goes federal government to state of Ohio and then to each county's health agency, correct?
Well, in some respects, yes, but also you have to remember that Ohio is a home rule state, and in Ohio we have what's called decentralized public health. So in a simple way to say it, the Ohio Department of Health is not the boss of the local health districts. We are all independent. We all have our own boards of health that make the decisions, and then of course hire a health commissioner to make sure that their vision for what goes on happens. Obviously, we're working very, very closely with the Ohio Department of Health and with the Centers for Disease Control. You know, we're all following the same guidelines and the guidance that's been given, all of the follow-up with the communicable diseases. As I said, We always do communicable diseases, so we have what's called the Infectious Disease Manual for the state of Ohio, and within it are all of those reportable diseases with a complete protocol of how those are approached and what the public health response is. With COVID, it is certainly a larger, like I said, a larger response, but really nothing that we're doing with COVID isn't the same thing that we would do if we had a mumps or a measles or a tuberculosis, and we have those periodically throughout the years. I've been in public health for about 22 years now, and we've had those things happen. The one probably that comes to mind is in the younger population. We almost every year have a few pertussis outbreaks, and that's whooping cough. So a lot of people don't know that that's called pertussis. And we do the same things with all of those that we're doing here. We look at who is the case, then who is their first circle of influence, and do any of those people have any signs, symptoms? Do they need to be quarantined? If any of those people become a case, then we look at that next circle outward. And while this is normal for us to do that kind of an investigation, again, certainly not on this level. We typically, in a typical year, might have between 1,500 and 2,000 investigations. And just in COVID alone, we are little over 3,000 as of about a month ago. So it's much, much larger, obviously, than what we normally do, but it is the same process.
That is very good information to know. And so that brings me to my next question. What is our current status, and where can people who live in Delaware County, where can they find the most up-to-date information?
So that's a great question. So hopefully people do follow us on our social media sites. So we do have a Facebook page and a Twitter. We do have a website. On our website, we have a coronavirus page that you can go on, and we do update the data with the specific numbers. Those are updated 3 times a week. On Wednesdays of every week, our epidemiologists put together a report that's called the Epi-Intel report, and it kind of pulls a lot of the data together and then goes a little bit more in depth, and those are released on Friday. And then we also have a newsletter that goes out. It was for a while going out every day. Now it's going out once a week on Friday, and if things would start to change dramatically, we could increase. But people can sign up for that if they'd like to get that. They can also go to our website and look at past issues. But on our coronavirus page, they can kind of scroll down to the bottom, and there's a place that says sign up for our newsletter. And so anyone who wants to get it directly into their mailbox, our public information officer, Tracy Whitaker, puts that out every Wednesday. It usually comes out about 3 o'clock in the afternoon. That's where we have all of the latest numbers. The Epi-Intel report is there. And then if there's anything else going on with COVID or anything else in the community that's health related, we put that information in there as well.
All, again, great information. According to your epidemiologists and anything that you've seen in terms of numbers or research that's been done, is there any discernible activity that is causing an uptick in cases? Is it as people become positive and those people are reporting to you, is it people who are going to the grocery store, or is it more activities in their home, or what are the activities that we're thinking are the ones that are bringing in the most cases, or do we even know this information?
Well, we do know it anecdotally. When we do an interview with the case, we do ask them what they've been doing in the 2 weeks prior to becoming ill. We ask them if they've attended any large events, if they know if they've been exposed to someone that was positive. One of the things that appears to be happening, we are in an uptick of cases. This morning when I looked, we had 264 active cases, and that is a case. So that's somebody that actually has the disease. That's what an active case is. And just to put that in perspective, on September the 28th, we had 156 active cases. So we have seen quite a large number of increase over the past few weeks. What we're finding is, as we interview people, most of them are not reporting that they've been to any of those large events, but it's more of the small get-togethers. So for example, we're working very closely with the schools, and if we identify a case at the school, we're looking at, well, are they on a sports team? Let's look at their classroom. Who has to be quarantined? Is it a staff person or a teacher? And we're just in constant communication with the schools to make sure that people who shouldn't be in school are not in school. But one of the things that we're finding as we do the interviews is it's not necessarily the fact that they were on a sports team together, but afterwards, maybe they had a slumber party or there was a big get together where they were all having dinner together. And so it's more of those casual family things. Well, not family so much, but those bigger gatherings that we seem to be having a lot of connections in those. Of course, we are seeing more testing. There's a lot more surveillance testing that's going on now than was going on. For example, all of our nursing homes now are required to test all staff and all residents every 2 weeks. So this is good because we're identifying those positive cases, but we're also probably identifying some of those positive cases that would be asymptomatic that normally would not have gotten tested. So it's good that we're doing all of this. It helps us to get a really good picture of what's going on in the community. We are actually looking forward to when there is more readily available testing. And we know there are places now in the county that you can go, and a lot of them are doing the rapid test, so you're getting your results right away. But the more testing that we can do and really identify if we have any of those pockets, the better we're going to know how to really drill down a little bit more and help people to figure out what they should and shouldn't be doing. The bottom line is we know we're having community spread. We really, really, really do need our community to all pull together and not just think about themselves and whether if they get this, they're going to be sick or they're not going to be sick, but really think about that sphere that you have that circles you. So for example, one of the groups that we've seen a lot more of in the last few weeks is that 20 to 29-year-old. So if you think about that 20 to 29-year-old who may be walking around, they are maybe positive, they don't know it because they're not having symptoms, but think about where they are in their lives. They probably have maybe children, so there's exposures. They also might be taking care of maybe their adult parents or even maybe their adult grandparents. And so there's, again, those exposures that are happening when you have that more mobile group of people that are having more of those positive tests. They probably come in contact more than even perhaps the older adult who's really kind of still hunkered down and, really trying to stay away from people. So although I know there's a ton of controversy around the face masks, and certainly we know that there are people that cannot wear them for a medical reason, and their physicians have told them you should not wear those. But for those of us who can wear them, we're really encouraging everyone to wear those. There are lots of studies out there that do show what happens if you don't have a mask on with your breathing and what happens when you do. Is it a perfect solution? No, it is not. But it is one thing that we can do. We can't put everyone in a bubble. We can't tell everybody just stay home and don't go anywhere. We know that we need to be worried also about the mental health of our residents, and people need to be able to get out and see, their loved ones and their family and do their grocery shopping. We're just asking you to try to do it as safe as you possibly can. If you have to go to the grocery store, don't take your entire family. If you don't have to, we know some people have to. Just one of you go to the grocery store. Wear your mask if you can, because you may be around people who can't wear a mask. Don't shame people that you see that don't have a mask on. There may be a very good reason that they can't. And likewise, if you're someone who doesn't believe in the mask, let's be kind to one another and think that maybe the person that has the mask on, maybe they have someone at home that's immunocompromised, that if they did catch COVID, it could be very, very detrimental to them. So wear your mask, good hand washing. That's, in public health, we always say that's the number one thing we can do. That hasn't changed with COVID. We know that the virus can live on surfaces. That is not the primary way, though, that people are getting this. It is more of the airborne and the droplet spread. But if I touch a surface that has it, and then I reach up and I touch any of my, what we call that T-zone on your face, you can get COVID that way. So really good hand washing is a great thing that we all need to remember to do.
That's all good information. And I do want to ask you a question about testing. So an issue that people are having is, so they've been notified that they've come in to contact with someone who has tested positive for COVID, and they must quarantine. But they are anxious to, let's say they're allowed to go back to school or work or what have you, and they must be out for a minimum of 7 days or 10 days. When should they be getting that test? Is it as soon as they know that they've come into contact with someone, or should it be a few days after, just to maybe reduce the likelihood that they would come back with a false negative, but maybe not have had enough of the virus in their system to trigger a positive result? Or are they, if they are, if it is early and they test negative, but they do indeed have it, that are they just someone that isn't going to produce that much virus to get other people sick? When should people be getting that test? Should they do it as soon as possible, or should they wait a couple of days?
So actually, just a couple of things to just clear up. So if you're put on quarantine, it is 14 days, because from the time you're exposed, what we know so far about this illness is from the time you're exposed, it could take your body up to 14 days to become diseased, to have a case. We actually don't recommend a testing strategy. Even if you have a negative test, if we've put you into quarantine because we know you've been exposed to a positive person, you still have to finish your quarantine for exactly what you said. You can get a test, but your body just may not have enough of a viral load to come up positive. It's not really a false negative. It just means your body doesn't have enough of the virus. And so we need you to stay quarantined for that 14 days and really not come in contact with anyone else. The isolated person is infectious for 48 hours. This is what the science shows. For 48 hours prior to the test or your symptoms, whichever comes first, and then for that 10 days afterwards. That's why if we put you in isolation because you're a case, that you have to be isolated for 10 days. Now that does extend to 20 days if you are immunocompromised, because it does take your body a little bit longer to fight off that, and you could be infectious for a little bit longer. But for the majority of our population, that isolation is 10 days. So testing, that's a great question about testing. So most of the tests that are out there are really made for symptomatic people, and it says so right on the guidelines for that, and with the FDA. Doesn't mean that we're not using it as a screening test. So the issue of the false positives, false negatives, that comes up all the time. There's a difference in the test. So there's an antigen test that's being done. Typically, that's the one that you get the results right away. That test is less sensitive, which means that you might get a false reading on that one more than you would if you have what's called the PCR test. And the PCR test is the one that typically it's taking between 24 to 48 hours to get those results back. They actually send that nasal swab off to a laboratory to do that. Doesn't mean we can't have one of those that shows up different than you would expect it to, but that is kind of the premier test. So if you have a positive antigen test, we do believe that you have COVID. All of these are detecting the virus, and so you really can't detect something that's not there. Doesn't mean there aren't some false positives, definitely doesn't mean that there aren't some false negatives, but for the most part, if you have a test that says you're positive, you probably are positive. It's the negative one that it goes the other way, because it could just be that your body doesn't have enough of a viral load yet to be detected.
And that is excellent information. That's what and thank you for the vocabulary there, the viral load, for it to have replicated itself enough to be detectable, and those sorts of things. Thank you so much for the information. You mentioned two distinct words and seem to be using them differently, not interchangeably. So can you let me know the difference between quarantine and isolation, and who's doing each of those things? And what do each of those things mean for the members of a household?
Okay, so those are great questions. We get asked that all the time. So isolation is for the sick person. So we want to isolate them away from other people so they don't make more people sick. A lot of people say that they remember that because isolation and ill both start with I. So if you think about, we want to isolate the sick person. Quarantine is what we do with the well people who've been exposed, and we want to watch them and make sure that they don't become ill. So we isolate the case. They're isolated for 10 days. And they have to stay completely away from other people and stay in their home. Quarantine then is what we do for the contacts, whether it's a household contact or someone maybe that they came in contact with at work or at school, maybe a meeting that they went to. So we quarantine them for 14 days. Now it does get a little bit tricky if you're a household contact. The only way that we can do those concurrently is if that isolated person can be completely away from their family members, which pretty much means they have to have a separate apartment because they can't share any spaces whatsoever, because like we said, this can be left on a surface, have to have their own restroom, their own kitchen. If they don't have their own kitchen, somebody has to bring them their meals. They have to have their own entrance and exit to the house. They have to truly be 100% absolutely no contact. Otherwise, what happens is we can't start the quarantine of those household members until the isolated person is finished, because remember, we said you're infectious for up to that 10 days. So if my husband and I, for example, we live in the same house, that whole period that I'm in isolation, that 10 days, during any of that time, my husband could get sick. So we can't start his quarantine until I'm off of isolation. So my last day of isolation, because it becomes his day 0, and then he's quarantined for 14 days past that. And that's for a household contact. Now, people who don't live with each other, day 0 is the last day that they were with the person. So if you and I were with each other yesterday and today you came down positive, I'm going to be a contact of you. But since I saw you yesterday, today would be my first day of quarantine. Now, if I saw you, today's Wednesday. So remember I said we do a 48-hour look back. So if you and I had been together on Monday, I could still be a contact of yours. Now, if we were together over the weekend, no. But if I'm your contact, then I have to quarantine for 14 days.
So for then isolation seems a lot more clear. Let's say I got a call that I through work or something, that I have come into contact with someone who has tested positive, and now I can start my quarantine. Does the rest of my household need to also quarantine, or is it just me? Who should be quarantining in a household then?
That's another excellent question. We get that asked a lot. So you are the contact. You are the person who came in contact with somebody that was positive. The rest of your family hasn't been in contact with anybody that's positive. So the rest of your family doesn't have to quarantine. Now, in your household, you should do the best you can to stay away from them. Make sure you wear a mask if you're going to be, because at any moment during that 14 days, you could get sick, and then your family would be contacts. But unless you do get sick, your family members are never considered contacts. So they can go around and go about their normal business. You, as the person that's the contact, should wear a mask. Try to stay the 6 feet away. Try to stay as separate as you can. If you do have shared areas, make sure you're wiping down those frequently used surfaces a lot. But you, and as the quarantine person, should try to stay away from your family as much as you can. And again, it's not because you're sick. Remember, the quarantine person at this point as well. But if you do become sick, then that's going to decrease their chance of also becoming sick.
Again, really good information. Thank you.
And it is very confusing. We understand that.
And so my next question is about COVID-related deaths. And I don't mean to bring up this subject lightly. I know that here in Delaware County, or at least within the health district, that we have had, I think it's 23 deaths. And of course, our condolences go out to all of those families and everyone who's been affected by deaths due to COVID. So I'm asking this question with the most respect, but there is a lot of misinformation and rumors and arguments, particularly on social media, about what is counted as a COVID death. Could you please explain for our listeners how COVID deaths are counted in that total?
Absolutely. So you're, again, another really great question that we get asked a lot. So in order to explain who gets counted, let me just talk a little bit about the death certificate in the state of Ohio. So the physician that is your normal physician, or possibly the coroner, or possibly the hospital physician, will be the one that fills out your death certificate. On the death certificate, it lists up to 4 or 5 causes of death, with the first cause of death should be the immediate cause. The second cause of death is what contributed. So if you think about it, it kind of contributes. Each of them contribute. So for example, let's talk about this. So say I'm in a car accident. The thing that kills me, again, no disrespect, right? Like you're saying, this is a hard topic, but to make sure that people understand this, if I'm in a car accident and I die, my cause of death is likely to be blunt force trauma, right? I hit my head, the car hit me, I fell out of the car, one of those things. That's my immediate cause of death, is the blunt force trauma. It's not the car accident, it's the blunt force trauma. But let's say that I was drinking. So my secondary cause of death could be alcohol. So alcohol intoxication could also show up on my death certificate. And sometimes when physicians write those, they might write those in different orders. So they might say alcohol and intoxication and then blunt force trauma. The bottom line is I died from the blunt force trauma, but what contributed to it was I was drinking and then I drove. Now maybe I also, let's say, maybe I also have lung cancer. They also might put lung cancer on there because maybe if I had been in better health or had less morbidities, maybe that blunt force trauma might not have killed me. And this is one of the things that happens with COVID. Maybe if I don't have all those other co-diseases, if I get COVID, I'm not as likely to die, but it doesn't mean I don't have those diseases. So if I was in the car accident, I had been drinking, and I also had lung cancer, all of those are going to show up on there, but what really killed me was the blunt force trauma. So now let's back up to what happens with COVID and how we count those. When we do the interview with the person, or in the case of a death with the family, that's how we identify who we're going to count as a COVID death. So here's an example. If I go in, say, for routine surgery, I'm getting old, I have to have a colonoscopy. So say the hospital decides that they're screening everybody for COVID before they go in, and let's say I turn up positive. So I'm going to the hospital, I'm not sick, I'm asymptomatic, but I turn up positive for a colonoscopy. I am a positive case for for COVID. So, but then I have my test, I have my colonoscopy. Of course, somebody drives you home because they give you those medicines and you can't drive yourself. So say tomorrow I'm out and about again and I have a car accident. Somebody runs into me and I die. Now I am positive for COVID, but COVID is not what killed me. And so we at the health district, we would not, even though COVID may show up on the death certificate, we do not count that as a COVID death. That makes sense?
I think so.
What does count as a COVID death is if that is what killed you. Now, a lot of times it's pneumonia. It's just like with the flu. The influenza itself is not typically what kills people, and we do have high mortality with flu. But it's because they then get pneumonia because of the flu. So pneumonia is what killed them, but it was caused by the flu. Same with COVID. They may die because they get pneumonia, but the COVID caused the pneumonia, so that would be counted as a COVID death. We've had so many questions about this that if you do go to our social media page, I actually put together a little, it's a PowerPoint, but it just shows up on your screen that kind of goes over death certificates in Ohio and kind of explains a little bit of this so that we try to make sure that we are only counting those that actually can be contributed to COVID and not some other reason.
Well, that's about as clear as you can be about that then. So hopefully that clears some things up for some folks and all the confusion out there are surrounding the numbers that are reported. So I do have a question that came in from one of our health and wellness participants this week. She writes to us, why are libraries and museums being so strict about COVID while restaurants and bars are crowded? It seems that touching books isn't really that concerning. Neither is passing by people in a museum, provided one is wearing a mask. Museums are in real trouble now financially. Why should they be avoided and not restaurants?
That's a really good question. So to look at that question, we have to look at a couple of things. So we do have the Ohio Director of Health and the governor who've put out the Restart Ohio guidelines. There are some things that are still on those lists that cannot be open, but museums and libraries are not on that list. They are allowed to be open. So they are allowed to be open. That does not mean that their boards, because most of them have their own boards, have decided that that's what they want to do. And it may be that they feel like they can't follow the Restart Ohio guidance because there's quite a bit of guidance in all of those for restaurants, for the bars. Anything you do right now that's allowed to be open, there are guidelines for those. And we have staff, we have a whole team of staff that get those plans, they look over those plans, they make sure that they meet all of those requirements, and then we send those back. We're having to do that for all the sports that are going on, both the school and also those inter-athletic leagues that are going on. We've been getting a lot now for the winter festivities, so we're looking at all of those. So one of the things the boards may have decided is we just don't have the staffing to be able to do all of those things that we have to do to follow the Restart Ohio. If you think back to the summer, we had several swimming pools that did not open. It was not that the governor nor the director of health said you can't open. They just said, if you're going to open, these are the things you have to do. And a lot of them said, you know what? We just can't do that and make it financially viable because we'd have to hire extra staff or those things. So there is an issue. We know that the COVID virus can live on surfaces. So I know, like in our library here in town, I think that if you return a book, don't know the exact number of days, but I do know in talking with Mr. Needham, the director, when those get returned, they do get put away and nobody else can check those out. And I want to say it's 72 hours. Don't hold me to that number, but I know that they're doing that. Your reader is correct. We don't think of just casually walking by somebody, especially if you have a mask on. We don't think that's a high risk. Certainly there's a risk. This is an airborne disease, but it's minimal if you're just passing by somebody. In a museum, at least the ones I've been in, you're not supposed to touch anything anyway. But one of the guidances would be that everyone should wear a mask. And the museum would be responsible to make sure that any of those high touch areas, so for example, a banister that everybody would be touching, their restrooms, those would have to be cleaned on a certain frequency depending upon the restart order. And they may have just decided they just can't do that right now. So there's nothing in the Ohio rules right now that say libraries and museums cannot be open, but there may be reasons that those boards have just decided they can't do it right now.
That's excellent information. I hope that answers this reader's question. I do have actually two final questions for you. One is, we're approaching the holidays. People over 55 have a lot of questions about traveling and family gatherings. What advice would you give at this point in the year?
I think the same thing that I said a little bit ago. Think about your own health and the health of those family members that you're going to be visiting. If you have someone in that circle that's very, very fragile, maybe they have a lot of different chronic diseases, you may not want to go visit them. And if you are going to go visit them, then maybe we can do it outside. Of course, it's going to get cold, so we're going to have to bundle up. But if we can sit outside 6 feet apart, try to limit the time of those visits to the less than 15 minutes, it would be safe to do that. It would be safer to do that. At this point in the game with community spread, unless you stay only by yourself and never leave your house, there's always a risk. But we do recognize that people need to be able to visit with their loved ones. So just think about, how can I do this the safest I possibly can when you're thinking about that. I have 3 little grandbabies. 2 of them are just born. I have a 4-month-old and a 2-month-old, and we're going to try to all get together at Christmas time. We will all, of course, not go if we're sick. We're going to be keeping track of any symptoms that we might have. Are we having any fever, any of those things? Obviously, before I hold those grandbabies, I'm going to wash my hands really good. Probably will wear a mask if I'm holding them. That'll kind of be up to their moms and how comfortable they feel with that. They're not sick, though, and I don't really have, in my immediate family, I don't have anyone that has, a lot of chronic illnesses. But let me say that, what if my dad was going to come? He's in his 80s. He's in pretty good health. I've been encouraging him to do what he feels that he can. I worry more about him sitting at home by himself and getting depressed than I worry about him seeing some of his friends, as long as he tries to do it as safely as he possibly can. And I think that's where we all have to weigh that out with ourselves. We are working with some of our communities. We've already been asked, well, what about Santa? No, we would rather you not have kids sit on Santa's lap. That's not the best way we can do that. So let's think about, are there other ways? Maybe we have a Santa and you can stand a little further away, and these really talented photographers, because we know we have some out there, can take the picture so it looks like you're all standing together, but you're 6 feet apart from each other. And maybe instead of giving Santa what you need sitting on his lap, maybe you write a list and you're able to talk to him and then drop the list in the bag for him. Kind of like what we've said about trick or treat. We haven't said don't go out and trick or treat, but we said let's think about doing this and doing it as safe as we can. So stay within your family member. Don't be intermingling with other families if you can help it. To the person who's passing out passing out the candy, try to stay a little bit back. Don't let a bunch of kids reach into one bowl and take candy. Maybe, you're the only one that puts your hand in the bag and gives it out. So just think about, how can we be as safe as we possibly can, but if I'm vulnerable or someone in my immediate sphere is vulnerable, then maybe I just have to say, no, I can't do that. And the last thing I would talk about is the visiting part. If you are going to visit and do it safely, don't visit 12 different families in the same day. My dad was in the Air Force, so we were often the family who was coming into town and then would try to see all the cousins and all the relatives while we were home. Well, in this day and age, especially with COVID, I would not want to go visit my aunt and then go next door and visit my uncle and then go see my grandparents, because all of a sudden, if I come down sick in those next couple of days, I've exposed every one of those households. So if you can, visit with one family at a time and kind of spread those out a little bit, so that if you do become sick, or maybe one of them is sick, you didn't just possibly spread it around to a lot more people.
I think that answer will make a lot of people happy and clear up some things, and help with some difficult decision making over these next few weeks. So thank you. And my final question is, I can't imagine the amount of data that you and your staff are dealing with right now. Can you talk a little bit about the effort that that a pandemic has brought to you and your staff at this time, and what the health district is dealing with in terms of workload right now?
Thank you for asking that. The thing the worry that's one of my top worries is our team. We went into what's called incident command on January the 30th. So we are coming up on 9 months of this. I don't know how many people out there know about health districts, but normally health districts work Monday through Friday from 8 to 5, no holidays, no weekends. Not that we don't respond, because we are on call 24/7, but in a normal year, we might have 4 weekends a year that we really have to respond to an emergency. Since about March, we've been open 7 days a week. Well, not open, but we've been here 7 days a week. We were working 7 a.m. to 7:30 p.m. every single day. Now, no, nobody was working 7 days a week, but we were there. We did just at the beginning of October go to an 8 to 6:30. So they're on 10-hour shifts now. And partly that's to give them a little bit of a break. You know, all of our staff have families too, and they're worried about their families and their loved ones, and, you know, trying to make sure that they aren't bringing anything home to them. But it is our responsibility as your health department to call you if we think you've been exposed to something. That's what we always do. With the pertussis example I used earlier, you know, I always used to try to tell people, don't worry about if you've been exposed, because we're going to call you if you've been exposed. What I would tell people right now is if you think you've been exposed, please stay home. We will be calling you or sending you a letter. Right now, with as many cases as we're getting every single day, we are sending out letters. We wish we had emails for everybody, because that would even hasten the process a little bit. But if you think you've been exposed, please stay home. We will call you. We will send you a letter that tells you what to do. A lot of times we're working directly, well, not a lot of times we're working directly with businesses and schools. So if that's where your exposure is, it may be your employer who says, we've talked to the health district, we've identified that you're a contact, you need to stay home for 14 days. We're going to give the health district your email address, and they're going to send you the instructions. You know, as this first rolled out, even though we were working all of those hours, you know, we were actually being able to keep up, and every single day we were able to contact every single one of the cases. We've hired about 12 extra contact tracers. So when you hear the governor talk about contact tracing, it may sound like it's one thing. It's really not. It's a bunch. And so we've hired people to help us with this. But with the number of cases that we're getting every day, especially with this increase in this antigen testing, and now also there's this antibody testing out there, you know, we're sometimes 70 cases every morning that our team is looking at between faxes and between what's in the state system. So we are right now, because we're in what we're calling our surge level 5, as most of the counties across the state are, we're having to send out letters first that give people a barcode, or a QR code, I think people call those, that we ask them, please fill out your interview that normally I would call you and do with you, and we still are doing this. It takes almost a half an hour to finish that interview. So we're asking our community, if you get this letter in the mail, please do answer that interview, give us your email address, and then we can get you those instructions out as quick as we possibly can. We have a COVID email, and it is somebody literally, that's all they do is sit at that email and get out every email that comes in, assign it to somebody on our team to make sure that those get answered as quick as possible. We also have 2 administrative assistants that are sitting upstairs, and all they do is answer the phones. And what's happening is those calls are coming in so quickly, either from someone that we've put on quarantine or isolation with questions, or our general public, which we appreciate you doing this, because hopefully this answers some questions, but we're trying to also answer all of those. So, you know, we want to be the very best health district that we can be, and we want to be as responsive as we possibly can. But the capacity right now, we are at our peak capacity. We just, like I said, just this week, we brought in 2 more people to help us do all of this. I could probably bring in 20 more people, and we still probably right now wouldn't have enough. You know, most of the folks that we talk with, honestly, they're so kind and so understanding, and they all want to do the right things too. Some people aren't. Some people are really mad at us when we talk to them, and I worry about my team. We did make the decision that on Christmas Day and Thanksgiving Day, there is not going to be anyone in this building. We are going to be on call. We have a responsibility to get to everything within that 24 hours and get those letters out. But we are going to let the majority of our staff take those 2 days to be with their family. And that was a hard decision to make because everybody feels such a commitment to do everything we need to do for our community. But I have to remember that I've got about 90 people right now, that there's not an end in sight for this for us. Hopefully the numbers will start to go down a little bit, but then we'll be ready to give the vaccine. So that's a whole nother thing. And I have to make sure that I try to take care of them too. So we have to do that. In fact, I just was in a meeting just a few minutes ago, and I reminded all of our leaders, tell your team to take some time off. You know, most of us have been doing this now for 9 months, 7 days a week. And so thanks for asking about that. But I have to tell you, our community as a whole, we have wonderful partners like SourcePoint, like our schools, our law enforcement partners, our EMS, EMA, United Way. I'm going to forget somebody, the 211 Center. I mean, everyone has come together to help. And, you know, I don't know how it is in other counties, but I say every single day to somebody, yes, this is hard. Everybody's working hard, but we couldn't do this if it were not for the partnerships that we have. And with everyone else trying to help us to get out the word about this is what we've got to do to get through this.
Well, thank you for those words. And thank you for letting us know. I wanted to ask because I knew it had to be a large effort. And I know and adore so many of your staff personally. And I want to thank you for taking the time to speak with us today. I also want to thank you and your entire staff for caring as much about Delaware County as you do. There are things that you are required to do, but you definitely go above and beyond and have been as responsive to the community that is a level that I have not seen elsewhere in other counties. And makes me proud to live here and makes me proud to be a part of it and to work for a partner. You know, things like the amount of graphics and other things that you've gotten out on social media that help explain what's going on, as well as the travel flow chart so that someone can measure them for themselves, what kind of a risk it might be for them or their family to travel. That's available as a tool on your website, as well as the PowerPoint presentation on how deaths are counted in the state of Ohio, particularly as rumors abounded across social media in the community for a time. I just really want to thank you for that, and thank you so much for your time today.
Well, I appreciate the opportunity, and I know I'm really wordy, so if you have to cut some of this, we certainly understand. And thank you for your kind words. I will share those with our team. And for your folks out there that are listening, if they know a public health person, just take a minute and say thanks to them. I know, you know, some people think that that doesn't mean a lot, but it really does. Every time I get a nice email or somebody stops me, I try to make sure that I share that with the team because it really does help. You know, we think we're trying, well, we don't think. We know we're doing the best that we can, and a thank you goes a long way. So thanks for saying that.
Very welcome. And again, I am Melinda Metz with SourcePoint, and this is the Health Commissioner for Delaware County, Shelia Hiddleson. Thank you again for taking the time to be with us today. Please join us at www.mysourcepoint.org for more information about what's going on in our community. Thank you.